and here is your stem. All right, so if you've read and understood, considering this critical care scenario, please tell me how would you manage this patient?
Okay, so first of all, I come into the room, I greet the examiner and wash my hand. And so this is a polytrauma case with a pelvic fracture. So I will approach this patient. I will manage this patient according to the ATLS protocol by A, B, C, D, E approach. I will first talk to the patient if he can talk or she can talk. Make sure that the airway is patent. Then I will check for breathing by looking at the patient first, looking for cyanosis, chest movement, symmetrical or not, and then any abrasion or wounds on the chest. And then I will connect the patient to pulse oximeter and look for SpO2 saturation. And if I see any abnormality in the breathing, I will manage accordingly. I will connect the patient to oxygen. I'll give patient oxygen. Then I will start by assessing circulation by doing vital signs and capillary refill, blood pressure, heart rate, and putting 2 large bore cannula. Then I will manage accordingly. In this patient, which is given that the vitals are unstable, I will give crystalloid to this patient, and then
How much?
I will
Please.
1 liter to 1.5 liter, and look for response. And I will put a urinary catheter for this patient to monitor the urine output, and I will connect the patient to a monitor to monitor the vitals. Then I will take blood for cross-matching for blood group and cross-matching, and then I will take blood also for electrolytes, for CBC, and for hemoglobin level. And then I will do later, when the patient is stable, I will look for other areas of the trauma, like in this patient it's written that tibiofibular fracture, so I will try to
Okay,
to
please
manage
tell
that
me.
also. Yeah.
Right, first of all, right, when you are considering airway, but if you go back and think, what is other than airway that you have missed in that step according to ATLS protocol?
So nowadays it's X, A, B, C, D. Yeah, so X is to look for any source of bleeding, active bleeding.
No. You'll, at the same time, when you're ensuring that airway is patent, you have to take care of the cervical spine. So
Yes,
how would you
spine
reassure
and
yes, collar with?
collar. Yeah.
Yes,
with the immobilization, with the 3 steps immobilization, with sandbag and collar.
Okay. Just pose sandbag and Okay, you'll tell me later. All right, just suppose patient's airway is not intact. How would you make sure, or how would you free the airway?
So I will look for the airway. I will, if there's any foreign body, any fracture in the mandible or mouth, and if there's if the tongue is, for example, in the way of the airway, I will clear that the airway, and
So it's
if
chin
I
lift
can't,
or jaw
chin lift,
thrust?
jaw thrust. Yes.
Yes. All right. Moving on to breathing. It says patient is having difficulty in breathing. Right. So
Yes.
how would you manage? How would you manage
So I will
breathing? So you'll give oxygen. How would
yes.
you make sure oxygen is given properly to the patient?
I'll connect the patient to pulse oximeter. I will look for
Yes.
cyanosis
Which
and
type of mask would you recommend?
rebreather mask.
Rebreathe mask, right? And if it's not possible to give oxygen via the mask, what else can you do?
I will think
If
of
you'll suspect pneumothorax,
I will put chest tube for the patient. I will think of
chest tube is too long, needle thoracotomy
needle
right away.
thoracotomy, maybe if it's more
Okay.
urgent in the second intercostal anterior knee.
Considering that patient has pelvic fracture and tibiofibular fracture, so what type of hemorrhagic shock can patient be in?
Hypovolemic shock.
No, grade. Which grade?
I assume this is grade 4,
All right. Okay, 3 to
class
4.
4.
Yes.
Yes,
How would you?
3
All
to
right.
4.
What are the things which are considered when you have to monitor a patient undergoing or suffering from hemorrhagic shock?
Circulation. I will try make sure that I will put 2 large bore cannulae.
No, for
And
the sake of monitoring. So you look for blood loss,
yes, for any signs of blood loss, any
pulse.
vitals.
How much
And
should be the pulse? How much should be the respiratory rate, and how much should be the urinary output?
in class 4,
In class 3 to 4. You're saying
class
4, I'm not saying 4, because 4 is, bye bye. So it's grade 3 towards
okay,
4.
tachycardia and respiratory rate and tachypnea also
Yes, how
in
much?
class 3. Tachycardia, heart rate more than 120, and tachypnea more than respiratory rate more than 20.
And urine output should be?
Urine output in class 3, it's less than 30.
All right. In order to monitor the response of the management that you're doing, what are you going to follow? So you're going to look for the monitor the
Look
heart
for,
rate, blood pressure,
yeah, the vital
capillary
signs.
refill time, urine output,
Yes,
and
and urine
mental
output, mental
status.
status of the patient, and
Yes,
respiratory rate also, the new score too.
right. And if you have done fast scan, what do you expect to see on the fast scan?
So maybe there will be, because of the abdominal abrasion and the patient is unstable, this stage of shock, the patient is, I expect that there will be intra-abdominal hemorrhage also and
Okay.
collection.
So in your opinion, would you go for in order to rule out if there is a liver tear or laceration or anything, how would you rule that out? Would you go for CT abdomen?
I prefer fast scan.
Fast scan, very good. Okay. What is the best product or for cross matching or for transfusion other than crystalloids?
Colloid and then blood.
Loads of blood. Okay. Which blood products would you suggest?
In this patient, I would suggest whole blood and maybe the cryoprecipitate also and plasma, fresh frozen plasma.
Okay, thank you.